Hi, everyone. I thought it would be great to bring on a genetic counselor. Her name is Natalie Richeimer, and she's from JScreen. And she's very passionate about educating people about their genetic risk factors. And she's very passionate about the IVF patient population, also because of her own personal journey. Oftentimes, I get the question from patients, and that question is, does IVF cause breast cancer? Thanks, Natalie, for joining us today.
Thank you for having me.
So can you just introduce yourself? Tell us about what you do as a genetic counselor. Talk to us about JScreen.
So my name is Natalie Richeimer, as Dr. Aimee said. I am a board-certified genetic counselor. And a genetic counselor, for those who don't know, we work with people in the fertility space and a lot of different spaces to help people understand their risk for genetic conditions, whether that's something they have themselves or a family history of, or maybe it's because of an ethnicity. And JScreen is an incredible organization that really facilitates for low-cost genetic testing for both cancer and carrier screening. And as a genetic counselor, I love working with them because genetic testing can kind of be a little scary, but we make it a little easier, a little more convenient. And it's such an important thing in the fertility space. I'm also a very proud mommy of 2 IVF babies. So I love everything about the fertility world, and I'm incredibly passionate about advocating for our fertility patients.
So I want to talk about how cancer, that diagnosis, can impact a fertility journey. Obviously, for me, I consider this an emergency condition. I literally drop everything for my patients with a cancer diagnosis and help them. As a genetic counselor, what's your role when someone has that diagnosis?
So again, for us, it's kind of 2 prongs. On the one hand, we have to think about fertility because that is, especially when we're dealing with certain types of cancer, something that needs to happen quickly. If somebody has an ovarian cancer diagnosis and we're working with weeks before we start chemo, we need to be helping guide them to someone like Dr. Aimee to help them through their journey. But another thing as a genetic counselor that we're going to be doing is figuring out if that cancer is something sporadic meaning something that just happens due to lifestyle, diet, environment, or is it something that's hereditary? And about 20% of cancers, Dr. Aimee, are due to a genetic change that someone is born with that puts them at a higher chance for cancer than the regular population. And so understanding if they are, having this cancer because of a purely genetic reason is going to be hugely important. And number one, making sure we can test future babies or embryos with Dr. Aimee, and she'll talk a little bit about that, but also can be really helpful in directing treatment. So, specifically with breast cancer, not all breast cancer treatments are the same. Depending on the type of breast cancer, we're going to treat it differently. If there's a genetic predisposition, if there's a gene change that's putting them at that risk for cancer. And the third thing is that it's going to change how we screen things. It's going to change how we think about their future. So I like to think a lot about, let's say there's a very famous gene that a lot of people know about, the BRCA1 and 2. Someone may come down with breast cancer from that, but they may end up in Dr. Aimee's office not because they're getting chemo right away, but because they're now at an increased risk for something like ovarian cancer, and they may have to be planning their families a little bit faster or sooner than they had anticipated without this cancer predisposition. So there's a lot of different levels how I, as a genetic counselor, get involved. And my job is really to make sure they're getting to people like you, make sure they're getting to the right care specialists like oncologists, making sure they're understanding what they should be doing next in their journey.
I mean, a cancer gene diagnosis. So if you have that diagnosis of a high-risk gene, for me, that's a fertility-threatening condition because you're never too young to get cancer when you have a gene like that. So that's why I always say, the more you know, the better things will go. And I'm sure as a genetic counselor, you face this where sometimes people are afraid to finding out the information. But do you find that nowadays that has kind of changed with people in our society, that people are more open to finding out?
There are people who love knowledge. Like, I am the information seeker in my family. I love it. And I have family members who are like, oh my God, I would never want to know that. Who would ever do that? And I think a lot of the patients, by the time they start their fertility journey, they are more information seeking because they're already in a little bit of a different headspace. Cancer for so many people is a very scary word,
Right.
because I would say whenever I talk to people, there's none of us who don't know someone that has been through cancer at one time or another. And that comes with a lot of trauma. But what I say to my patients and or people who I'm talking to are thinking about it, you were born with this genetic
Mm-hmm.
change. Really, your choices are just if you want to do something to reduce your risk of cancer, if you want to make sure that you're able to plan your family without interruptions.
Mm-hmm.
And that's that person's choice. And I think when people reframe it that way, like, oh, I have this whether I choose to find out or not,
Right.
it really changes that. And so many people would do things differently. Like I'm a mommy of two boys. I think back to my early 20s, all the things we would have done differently if we knew what was coming up later,
Right.
And,
Right.
and that's what I say to people, this is giving you a crystal ball. It's
Right.
up to you if you want to take it, but it's a
Right.
crystal ball.
And then you can screen embryos through IVF with a technology called PGTM, where we can test embryos for the gene, should you want to prevent it from being passed on into your family. So you can screen for genes like BRCA, 1 and 2, for Lynch syndrome, almost any gene that you're positive for that could increase risk of a genetic cancer, you can test your embryos for. So what about people who, let's say, are unaffected with cancer? Should they also consider hereditary cancer genetic testing, or for people who don't have it in their family? What is your position on that? Who should be doing this type of testing?
I will say we've come such a long way in genetics, and we're going to come even further in the next 10 years. It used to be like the secret menu at Starbucks, only some people were offered genetic testing, and we were realizing more and more that cancer is the second leading cause of death in the United States. It's incredibly prevalent. And we used to think, oh, it's only a tiny subset of people that have, a gene change that's really putting them at risk. The more we're learning, the more we're realizing, actually, no, there's a lot more going on. And so I like to say to people, if this is something that you want to do, especially if you're going into the space of IVF, right? Like if you're going into the space of IVF, there's a chance that you could stop with you. Like your babies could be at a decreased risk. You can do that. I definitely would say it's worth a conversation. I would say having no family history of a cancer is not the same as having an unknown family history. So what do I mean? I mean, people who've been adopted, people who I don't really have much to do with mom and dad's family. They're way out in, a different country. They're in South America. We have nothing to do with them. We may not know about all their family histories. And so I still think it's a very worthwhile thing to do. The flip to that is people who have serious family histories, who are often really, I would say, gaslit sometimes in a medical setting, like, oh, yes, your dad and your grandpa and your brother had prostate cancer, but you're somebody who doesn't have a prostate. You don't need to get testing.
Mm-hmm.
What I will say is that cancer looks different in different bodies. And so maybe you don't have a prostate, but sometimes prostate cancer can put people at an increased risk for breast cancer or other cancers. And so I definitely think people should be getting the information. And I think we're moving to a place in medical genetics where this is going to start becoming population, meaning open to everyone. The other thing I want to talk about is certain ethnic groups. Even if you don't have a family history, we know that are at an increased chance or risk for having a genetic change.
Mm-hmm.
So a famous example is people who have Ashkenazi Jewish ancestry. And that doesn't mean that both your parents were Ashkenazi. It could mean grandma was Ashkenazi or grandma. You're at a 10 times greater risk of carrying a genetic change in BRCA 1 and 2 compared to the general population. So the carrier chances in the Ashkenazi community, 1 in 40. In the general population, 1 in 400. So depending on your ethnicity, and there are specific things in specific ethnicities, you should have a chat about that. If we want to take care of our health and our cancer risk, you should be definitely thinking about that.
Yeah. I offer this testing to even my egg freezing patients. And just like you said, if let's say you had family members with cancer, oftentimes I'll tell patients who have a type of insurance, let's say an HMO that won't cover it, I'll encourage them to go to their doctor to see if they can get coverage for the testing. And I would say almost always they're told that they don't, quote unquote, qualify for it. So that's why I was really glad that you were available to talk to us about this today, because that's where JScreen comes in. So tell us about JScreen and how people can get tested and how special and important it is for people to know about it.
this happens all the time. People don't need guidelines. We have specific guidelines in cancer societies called NCCN, and insurance companies will use that to disqualify as many people as possible. Insurance companies don't really want to pay for things, and it's really unfortunate, but that's the reality. The other thing, and this is, I think, a huge hurdle, is that you have to have a doctor to order it. So for some of us, we don't have PCPs that are comfortable ordering it, or maybe we don't have a PCP. Maybe you and I are both in California, maybe you're in Kaiser,
Right.
and they won't do it for you, and you don't have anything you can go out of network. So JScreen is really something that's focused on access. It's available to anybody. And what they essentially do is you can order the test online. It's a spit kit, comes to your house. And I get this question all the time. Is spit the same as blood? If you do it right, it's the same.
Don't kiss, don't eat, don't chew gum, don't brush your teeth, don't wear lipstick. And
all the stuff.
Yeah.
And it's 30 minutes of your life. And then you can do all those fun things again. But the spit is just as good. It comes straight to your house. You pay $49 up front. That's just a registration fee that we have. And people with insurance typically will get coverage. And so some people will only pay $49. But let's say you're HMO, you're Kaiser, you have zero insurance whatsoever. The max out of pocket you will pay, including that registration fee, is $298. The testing tests for 48 genes that we know put people at an increased chance or risk for cancers. And it's not just breast cancer. Breast cancer is something we're talking about, but it screens for other cancers like prostate cancer, colon cancer, ovarian cancer, gastric cancer, a lot of other things, a lot of other cancers. It's really comprehensive. And my favorite part is that after you get the results, you might be like, what do I do with that? That's the scary part. Your testing includes meeting with a genetic counselor just like me, who goes over all the results, tells you what you should be doing with that, who in family should be getting tested next, and how that may impact your fertility journey. And that makes you a more informed patient when you're meeting with your REI, like Dr. Aimee, to have a really great conversation of, what do I do with this? Okay, well, I spoke with my genetic counselor. I know I should be doing PGTM. And if I'm doing PGTM and I'm selecting embryos and I only get, affected embryos, I should be going with male versus female embryos because the risk is lower. And so having that education, making yourself an informed fertility patient, will just make your treatment so much better and so much more tailored to you.
Yeah. Do you ever get the question, well, I did 23andMe, isn't that enough? I knew you would, because I do too.
I get it
How do you,
all the time. And I want to talk about 23andMe. 23andMe is the fun Christmas gift that we all want. We want to know if we have some interesting ancestries, Native American, and my African American, my Nigerians. And that's cool. And I love that. I think that's great. It is not medical grade testing. When I talk about genes, I want you all to think of genes are just a giant paragraph of instructions. And what we do at JScreen and what we do with our partner lab Myriad is we literally read through the instructions. We do a spell check and we check for missing and extra words. That way we're making sure in all ways that this is a gene that should be working. If it's not working, we say that puts you at an increased risk for cancer. There are like hundreds of mutations in the BRCA1 and 2 genes. I use that as an example. They test for 3.
Yeah.
So I have people who come to me and say, but I tested for BRCA1 and 2 with 23andMe and I'm A-okay good. It came back negative. And I said, well, you tested for 3, but there are hundreds more that you didn't test for.
Right.
Besides them not testing for enough, it's also not medical grade testing. Like, we don't know if the testing they're doing is actually up to snuff, laboratory wise. And so with information like this, which is life-saving, you want to make sure that you are getting the best information. We're all about the cars we drive and the manicures we get. Yeah. We should be about the testing we get. Quality matters.
Well, thank you, Natalie, for joining me today and talking about such an important topic. Is there anything else you want to share?
The biggest thing is that people are going to watch this and people are going to have questions. Reach out to us if you have questions. But also, understand that the scary part is testing and thinking you could be positive. I also tell people to flip, you might be totally negative, yay. And then that's something you can go into your fertility journey knowing that I've crossed that off. But most of the people I speak to who've done testing have been so satisfied with it. And the people who haven't, a lot of the times, they find out later they could have done testing. So speak to the people you need to speak to, be your best advocate. I see so many interesting comments. People who are starting to follow should read that. And genetic testing is amazing, as you can see. I would say if you are a fertility patient, this is my biggest thing because I've been through this myself. You are spending so much time and money to meet with an expert like Dr. Aimee. Make sure you're doing as much testing as possible so that you can have that tailor-fit fertility journey.
Yeah, and for patients who, for example, aren't necessarily being told what's available to them, you can talk to a genetic counselor and find out more about your family history, have you do a pedigree with them, and I'm sure offer them appropriate testing.
Yeah, and I will say the one thing that I've encountered, and I had a patient who came to me. I'm going to tell you a little anecdotal story,
Yes,
if that's
please.
okay. Patient came to me, and this is a family friend, so we know each other. And she was like, yeah, she really advocated for herself a lot. Her dad had prostate cancer. Her grandfather had prostate cancer. Her uncle had pancreatic cancer. Her new auntie had colon cancer twice. This is a strong family history of cancer. And on top of that, she's Ashkenazi Jewish with 4 grandparents. She, plucked up the courage, went up to her PCP and said, I'd like cancer genetic testing. And her doctor said, well, you don't have breast cancer in your family, so you won't benefit from this testing. And she felt like really discouraged and came to me and just to check, like, am I wrong? Like, should I not be able to get testing? And I was like, you're not wrong. Your doctor just might not know about that. And so if you feel like your doctor isn't understanding, JScreen takes away a hurdle for that. Anybody can order, even without a strong family history, even without your doctor, signing their stamp of approval, if they don't feel comfortable. I want to let people know you're your best advocate. You know your body the best. And if this is something that you feel passionate about, you should be able to have access to that testing. Everyone should.
Sometimes I have patients, they come in and they have a parent that had breast cancer, for example, and I'll always ask, would you like screening? They say, oh, my mom did screening, so I'm fine. So when I hear that, I just think that things have changed. The panels are bigger. Your mom might have not had all the screening. How do you address that?
I feel the same way. First of all, I'm always, as a provider, say, can I see the testing?
Yes.
Right? Sometimes what they think they were screened for is actually different. No, they didn't have genetic screening. They tested, germline screening where they're looking at the genes. They tested the tumor, right? That's a different kind of testing. So I want to see the screening. I will say for me, like, the testing from 5 years ago is leaps and bounds behind what we're doing now, and it will continue to update and change. We're getting better. Our panels, which is the amount of genes we're testing for, are getting bigger, and we're learning more. So I would highly recommend, especially if there's like a family history of cancer and it's strong and nothing came up, you should definitely revisit testing. I know that it's not what people want to hear sometimes, but it really is the best thing to be doing. And like I said, we talked about 23andMe. Sometimes that testing was 23andMe. So making sure not only if the testing was good, but, if it was comprehensive. And again, our methods are getting better. We're getting better. And I often see, like, when people tell me, like, oh, my grandma had testing, right? We don't have records for that. Told her it wasn't genetic. I've had that so many times. I've had people with really strong histories of ovarian cancer, and they tested genes, they said it wasn't. Sometimes what doctors are saying or what patients are hearing are not necessarily correlated to the testing we have.
Right.
So I would highly recommend, I always do a plug for reproductive screening too. If you did carrier screening 10 years ago and you're doing IVF, do a new panel.
Same.
Completely different.
Yeah, our panels 15 years ago were like 10 genes. Now they're like 600.
Yeah.
So absolutely.
It's crazy. We've come a long way, and we're going to keep coming longer. So I'm excited to be part of that journey.
Same. Well, thank you so much, Natalie, for joining me today. And I'm sure people will be reaching out to JScreen to get screened. And I hope we helped at least one person by doing this call.
Of course.
Thanks.
And anyone has questions for myself, feel free to DM us, and we would love to help you.
Awesome. Well, thank you again. Have a great night.
Have a great night.
Talk to you soon. Bye, Natalie. Bye-bye. Bye.